Officials in Texas are taking steps to reopen parts of the state this week. There have been over 19,000 cases of coronavirus, according to the Texas Department of State Health Services. Nearly 500 people have died. All non-essential businesses have been shuttered since April 2nd. On Friday, Republican Governor Greg Abbott announced a strike force of doctors, state leaders, and business owners to oversee what he called a phased opening.
First, will be openings announced today that include activities that should pose minimal or no threat to expanding COVID-19. Second, additional openings will be announced on April the 27th after further input from the advisors and the medical staff. Third, even more openings will be announced in May when it is determined that the infection rate continues to decline, that hospital capacity remains available, and when testing capacities are sufficient to detect and contain outbreaks of COVID-19.
Texas Attorney General Ken Paxton joins me now. He is a member of the governor's strike force. Mr. Attorney General, thanks very much for joining us.
Thanks for having me on.
I'd like to start with the timeline of your state's reopening. First up, I understand, were state parks. What is next, and what are the benchmarks to move into the next phases of reopening?
The state parks opened today, and actually the order directed different types of functions opening in different ways. For instance, medical services were loosened. They're not as restrictive as they were. They still have some restrictions on them. They weren't completely opened up. So retail operations were opened up in a way that they could now have the people working at the store walk out to the parking lot and hand off merchandise. So different types of businesses are being opened in different ways, which is not very surprising.
We heard in that soundbite a moment ago the governor mentioning testing. Texas is a state of 29 million people. It has ranked near the bottom out of all the states in terms of coronavirus testing per capita. What is your state doing to increase testing capabilities?
So we're obviously have a lot to do on that. We have such a large state, 28 million people, so there's a lot of potential testing. And so I can tell you this, we're dedicating a lot of time, energy, and resources towards that effort. I think that you will see a significant improvement over the next few weeks in our testing capabilities. It is a challenge when you have 28 million people to try to figure out how to test the ones you need to test.
Given the size of the challenges there, do you think there's been enough support from the federal government regarding testing?
I think everyone was slow to realize that this was such a major issue, and it happened so quickly. I do think now that we're in the middle of this, I think there are resources coming from the federal government in a massive way, and I think that'll be particularly helpful for the state as large as Texas.
You know, there's been some debate, as you know, about the role of the states versus the federal government when it comes to testing. We've heard President Trump talk about testing really being a local issue for the states. Do you agree?
I think that's where it's probably best done. Get us the resources, get us the financial resource, get us the information that the federal government has on the best way to test. And the state is doing a lot of that as well. We're shifting a lot of the focus down to the local level because that is the place that you best reach the people. So yeah, I think that is probably the best way to go as it relates to testing.
Well, Governor Abbott's order will loosen restrictions on some non-essential surgeries. I know when it comes to abortions, there is an ongoing court fight as we speak, but right now abortions will not be included. Can you explain why?
So when that order was first issued by the governor, it included all elective surgery. So it didn't single out abortion. Abortion sort of singled out itself. They were the only industry or the only part of the medical profession that thought that they should be exempted from the restrictions. There was no other group, ophthalmologists, dermatologists, dentists. They were all part of it and they participated. And obviously they're making a sacrifice. Everybody's making a sacrifice. The abortion industry was the one part of the medical industry that did not want to make that sacrifice. And the sacrifice was this. We're trying to save lives. The governor's goal was to save as many lives by leaving hospital beds and equipment and then the medical personnel themselves available to help people that were most at risk. And that was the goal, save lives. Unfortunately, most Texans were behind that.
And what do you say to the critics who argue that they view this move as what they call political opportunism, and they say that the amount of protective equipment required is not necessarily such that it would impede the efforts to battle coronavirus in your state?
I think there's some argument to be made in every part of the medical profession that they should be or shouldn't be in this order. The reality was we have a blunt instrument here. We didn't know exactly how the coronavirus was going to affect our state. The governor, in my opinion, is doing his very best to figure out how to save the most people. And he did not single out a particular part of the medical profession to exclude. He included everybody. It just so happens that abortion providers are part of the industry, and they were included, and they were the ones that felt like they shouldn't be out of all the groups that were included.
I want to turn to a study from the University of Texas, which projects that it could still be several weeks before Texas sees its peak of COVID-19 deaths. How concerned are you that your state's plan to reopen could be hindered if cases and deaths continue to rise?
So that's always a concern. I mean, if we're increasing the number of cases and deaths, we obviously still have a major problem. No one really knows how this is going to play out. I've seen all kinds of different studies from other universities that weren't quite as accurate as they were predicted. I know that even the federal government thought the numbers were going to be much higher than they have been. So, you know, there is no perfect way to do this. There's no governor that's going to know exactly the best way to go. And it is a balance between allowing people to live and to work and protecting their health.
Well, last week, a state judge said he will issue a temporary injunction to allow voters who are concerned about catching the virus to vote by mail in the upcoming July primaries. You've publicly voiced your opposition to this. Are you going to appeal that decision?
Yes, and we have already appealed that decision. The judge was basing it on, I guess, emotion, feelings, whatever. The law is very, very specific as set out by the Texas legislature, which is if you have a disability, then some type of physical disability that impedes your ability to go vote, you can vote by mail-in ballot. But the idea that you can vote by mail because you have a fear of contracting a virus is not part of the law. So we're just defending the law as it is, not as the judge maybe would like it to be.
And then what would you say, Mr. Attorney General, to those who do genuinely feel that voting in person at a time when there is no vaccine and no fully tested treatment for this virus means potentially risking their lives in order to exercise their right to vote?
I understand that. I mean, there are going to have to be some efforts by those who are doing the voting to distance themselves, just like we have going to the grocery store, going to the pharmacy, going other places. But the law is what it is, and my job is to enforce the law. It's not to make it up or change it or even like it. My job is to enforce the law as it is, and the law as it is we have mail-in ballot for certain purposes, and that's if you have a physical disability. In this case, fear of getting a physical disability is not part of the law. So if the legislature decides they want to change it, then we'll adjust to the change.
All right, Texas Attorney General Ken Paxton. Mr. Paxton, thank you so much for joining us.
Thank you. Have a great day.